Good evening, everyone, and thank you for joining our latest Ask the Leaders Facebook Live QA. I'm Councillor Carol Runciman, Executive Member for Health and Adult Social Care at City of York Council, and I'm Chair of the City's Health and Wellbeing Board. For those who are tuning in for the first time, I'll shortly ask the panel to introduce themselves, and then we will begin to answer the questions which you have been sending in. This week, I'm pleased to be joined by representatives from York Mind and York St John, from our local GP service and from City of York Council. We look forward to discussing your questions, particularly how to promote health and well-being and on the latest national guidance. Before I go on and ask our panelists to introduce themselves, I'd just like to touch on a number of key issues from the past week. Firstly, I'd like to thank local residents and businesses for their hard work in helping to reduce the spread of the virus. York's rate of infection remains well below both the regional and the national averages, and a lot of that is to do with the efforts of our residents. Nonetheless, we must not be complacent and undo this good work. We know that this has been a difficult year for everyone, but it's vital we continue to follow the public health advice and do what we can to protect the places and the people that we love. It's important to highlight that despite the restrictions, the city's parks, public toilets, household waste and recycling centres all remain open, and most of our services will continue throughout December and January. There is also a light at the end of the tunnel, as York's first set of vaccines were administered yesterday, and we'll be talking more about that. But whilst this huge logistical problem gets underway, it's incredibly important we continue to follow the national guidance and look after ourselves, both physically and mentally. We know that this time of year can be difficult for some, so if you need support, the Council is always on hand to do what it can. You can always call our helpline 01904 551 550 or email us at covid19help@york.gov.uk. Now I'm going to ask the members of our panel to introduce themselves briefly. And can we start with Owen, please? I'm sorry, Owen, we've lost your sound.
Good start. My name is Dr. Owen Kavanagh, and I'm a senior lecturer in Biomedical Science and Biosciences at York St John University. And I specialize in teaching and researching in viruses and immunology.
Thank you. Alyson?
Hello, my name's Alyson Scott and I'm the Chief Exec from York Mind and of Doncaster Mind.
Thank you. Gill?
Hello, I'm Dr. Gill Towler. I'm a GP at Haxby Group Practice in York.
Thank you. And Sharon?
Hello, everyone. I'm Sharon Stoltz. I'm the Director of Public Health for City of York.
Thank you to everyone. So we have a number of pre-submitted questions, and I'd like to thank everybody who has sent their questions in advance. And we will begin with those, but you can post your questions in the comments section and we will pick those up as we go along. Before we start the questions, Sharon, Owen and Gill are going to give us a brief update on the present situation. Sharon.
Thank you, Carol. Well, as Carol has said in the introduction, York continues to buck the trend really in terms of Yorkshire and Humber for our case rates of COVID-19. So we continue to have the lowest rate in the Yorkshire and Humber region, and the number of cases that we're seeing, our 7-day case rate is staying low. What I would say around that, though, is that our numbers have stopped falling. So they've stabilised at a rate of around 60 per 100,000 population. And there is some indication that over the last couple of days, those numbers may have just started to rise a little. So we're seeing on average around 18 or 19 new cases of COVID every day in York. And so even though our case rates are great, and thank you to everybody who's worked so hard to keep our infection rates low, we're still seeing new cases every day. And it doesn't take much for those case numbers to suddenly increase, as we saw in York in kind of September, early October. And so it's very important that people continue to follow the infection control measures and hands, face, space, particularly as we head into Christmas. We haven't seen any large outbreaks in York. What we're seeing is largely isolated cases or clusters of cases, tend to be in households, no large outbreaks, well-controlled numbers in our care homes and schools. So again, a more positive picture than other areas, but just that kind of warning really around that due diligence that every one of us needs to be practicing to ensure that our numbers stay low. So I'll stop there, Carol, thank you.
Thank you. Owen. Sound on, Owen? Yeah.
Thank you, Carol. That's really positive news about York, and I hope everyone stays safe over Christmas and takes all the precautions. So, like I said, I'm a viral immunologist. COVID is actually the name of the disease. The name of the virus that caused this disease is called SARS-CoV-2, severe acute respiratory syndrome, coronavirus number 2. Not the catchiest name, but that's the virus that causes this disease. The virus itself is causing so many different side effects that we've never seen before. It's not simply a respiratory disease. It goes much further than that. It affects all the organs of the bodies. It seems to be genetically linked, where some people will be more affected than others. We already know it's age-related and comorbidities as well. It's highly contagious, and about 80% of people who are positive, who do have the virus, are asymptomatic, so they show no signs of infection, so they can be spreading the virus without even knowing it. This is why the precautions that the UK and York City Council are recommending have to be adhered to defeat this virus. And I think the results we're seeing in York City show that these steps do work. So congratulations to the people of York. Job. So as I mentioned, SARS-CoV-2 is a virus. The virus is so simple. It's just a few genes wrapped in a bit of lipid or fatty bag, and it's got spikes on the surface. This is why it's called a coronavirus, because if you look at the virus, it looks like a crown, a coronavirus. So immediately once we get the sequence, so the actual code for the spike proteins, vaccine producers went to work to develop many different types of vaccines. There's over 100 different types of vaccines in different levels of clinical preparedness. There's currently one approved for medical use called an RNA virus, and that's the one that's currently being rolled out in the UK. The first country in the world, by the way, to roll out these vaccines. There's many other different types. You've probably heard of the Oxford vaccines. That's being processed as well. There's one in India, there's one in China, and there's one in Russia as well. So there are vaccines available. The one in particular that's been approved for use in the UK is, like I say, it's an RNA virus, RNA vaccine, and it was the quickest to achieve results because it doesn't need the virus to replicate. It takes the code from the virus, so it cuts out a lot of the steps of the virus. The vaccine has been improved, and as of the 10th of December, it's been shown to have 95% efficacy. So that means The placebo group, which was a non-vaccine based, had a lot more cases of COVID than the non-vaccinated group. So it's positive, and that's where we're at. Basically, we have a vaccine. There will be more in the future to address issues like the cold storage that's required. So there will be more in the pipeline for the future. Thank you.
Thank you, Owen. Gill, you're very near the, it's not a chalk face, it's a patient face. I wonder if you could give us your thoughts.
Yes, thank you. Yeah, and thanks for that, Owen. That was really interesting. Yeah, so I'm very pleased, and we're extremely proud to be part of this, which is the biggest vaccine programme in NHS history. At my practice, we are delivering the vaccine, and we have already started delivering the vaccine on behalf of our local PCN. That's a primary care network, which is a group of GP practices. We started with a small number of patients being vaccinated this week, according to the priority list that we've been given. So other York practices will be working together to deliver the vaccine very soon. It's being rolled out in waves, and each week more and more practices will be coming on and joining in that and working in their teams together. We're extremely proud of the way our teams have worked in delivering this vaccine so far, and the organisation of setting it all up. People have worked fantastically together, and our patients have worked brilliantly with us as well. And it's been a really, really good streamlined process. So we're really, really pleased about that. But it is very complex. As you'll have been aware from things that you've heard in the news, the vaccine is not one that's straightforward to give. So we have to have very, very careful procedures in place to ensure that it's done carefully and properly, and we're complying with all the regulations all the time. And that's what we're doing. So we're working in teams, and we're working very closely together to ensure that everything is done very, very safely. And we're very confident in the way that we're managing to do that. So the priority groups of the vaccines have been decided nationally, and patients will be invited as soon as more vaccine becomes available for the priority group that they're in. So one of the key messages I would like to get across for anybody listening, patients listening, is please wait to be invited. The NHS will invite you. You will be contacted. You don't need to contact your surgery. Please don't contact your surgery. We will be in touch with you as soon as we can, and as soon as the vaccine becomes available, we'll be rolling it out more widely. So at the moment, it's just a start we've made this week, but it's been a brilliant start. We're really, really pleased. Just to be aware that some of our normal services might be affected at this time, whilst we're prioritising getting the vaccines done. Clearly, we've also got more teams who are seeing all our usual, doing all our usual activities that we need to do, speaking to patients we need to speak to, when necessary, seeing patients face to face if it's needed. So please be reassured that all those services are still in place, but it may be that some of the things that are less urgent, it might not be quite so easy or quick to access those at this time. But so far the situation is going really, really well, and I say we're extremely pleased and extremely proud of how it's working and what we're able to be providing.
Thank you, Gill. I'm going to now ask some of the pre-submitted questions, and the first one is for Sharon, and this question is coming in thick and fast, Sharon, and it won't surprise you. The questioner says, with York in a much better position than neighbouring cities and urban areas, what will be done to protect York and its residents if we became the first city in North East or Yorkshire to enter Tier 1? The questioner says it's inevitable that this could lead to many travelling in from Teesside, Hull, Leeds, Scarborough, etc. to go to the pubs on the weekends. And the questioner thinks that will cause a lot of ASB, which they say is a problem anyway. Sharon, would you like to take that one on, please?
Yes, I can do. And this question has, or a very similar question, has come up before in these sessions. It's actually very difficult to stop people travelling into York from Tier 3 areas. Obviously, the police do what they can to be able to try and control travel. But people will come into the city in cars, on trains, on buses, and it's impossible really to stop all travel into the city. I've said before, on these sessions. You know, York isn't an island, and there are a number of routes into the city, so it's very difficult to stop people arriving. What I will say, though, is that as a city, all partners across the city, including our businesses, our shops, etc., have worked really hard to make sure that they're COVID secure. What we're asking visitors to the city to do is respect our residents and our staff working in shops, in pubs, restaurants, etc., and ensure that they're following the COVID secure guidelines. So, encouraging people to wear a face covering, to respect social distancing, to wash or sanitize their hands regularly. And we have a number of bid marshals and now COVID marshals within the city that are helping to reinforce those positive behaviours. And businesses themselves are doing what they can to ensure that if anybody is wanting to book a table in a restaurant, for example, they're trying to, as far as possible, check where those people are coming from. So we're doing what we can. But I would just like to reassure people, and I think, as we were saying earlier, the fact that our numbers are quite low in York, we've managed to control the virus very well in York. And that is really because it's been the whole city working together. So for residents, I would just reassure people that provided the city continues, everybody continues to behave in a COVID secure way, the risk of the virus coming into the city is managed as far as possible. So it's a balanced risk, and also we need people to come and shop in York and spend their money in the shops and businesses in York, because that's what's protecting local people's jobs and people's livelihoods. So it's a balance between public health and ensuring people stay safe, alongside the fact that we don't want to see mass unemployment in the city, and we don't want to see businesses go to the wall either. So it's got to be a balance, and we're managing that balance on a day-to-day basis. So but we're taking all of the steps to ensure that people stay as safe as possible.
Thank you, Sharon. Thank you. Now, there's all these people in the city centre all buying things, but there's a lot of people who are at home very lonely. And this is a question for Alyson, please. The questioner says, what options for support are available for people who will be alone this Christmas? And I know Mind's done a lot of work with people who've been alone during the pandemic. So would you like to tell us about that, Alyson?
We have, yeah, we moved our services online very quickly, as most people did. And what we also did was start offering calls to people so who were in the service but who couldn't come to our groups, etc., and who didn't really want to do Zoom or join us on Teams. They didn't mind a telephone call, but they didn't want to do anything more. And that is still available on our website. And also on our website is several other places that will be open over Christmas. So I'd perhaps refer to the Haven as being one of them, and various helplines, obviously the Samaritans, places like Papyrus as well. But again, all the details, if people go onto the York Mind website, they are all there to see what's available over Christmas as well.
Good, thank you, Alyson. And this is another one that's had a lot of airing, and this one's for Owen. There's been a lot of speculation on social media about the safety of the vaccine and in the press. How do people know it's safe? And is one vaccine better than the others?
Yes, this is a really important question about safety. So I think to eradicate or to squash this disease, we do need quite a high coverage, maybe 70% coverage in the UK. To do that, we have to persuade people who are cautious, and rightly cautious, about taking vaccines because of what they've read in social media. The current clinical trials to show the efficacy and safety of the different vaccines have composed of approximately 100,000 people to date. The one that's been introduced in the UK, or is used in the UK, but had almost 22,000 people in the vaccinated side of the study, 21,000 or so in the non-vaccinated side. The ages as well, 42% of the study was done in people over 55, which is the key area, and it was a very diverse population tested. The safety so far, up to, in a smaller amount of the study, 14 weeks after the second dose, so the booster dose, the safety results have been absolutely fantastic, with very minor side effects from the actual immunization, from the injection. It is something we need to continue monitoring, because there is nothing more important in eradicating this vaccine or squashing it than ensuring that the vaccine is 100% safe and there is no side effects, because the damage that would cause to the vaccination program would be unimaginable.
Good, thank you very much. Gill, I've got a little clutch of questions coming in for you. Somebody says, and you partly answered this earlier, why haven't I been contacted about the vaccine? How will I know when I'm eligible? And somebody else has asked, and you may be able to answer this one. This is Dawn on Facebook, saying, what about the staff at the hospital? Are they going to be vaccinated? And do we know that the hospital is safe for us to go to?
Okay, thank you. So these are really good questions. I mean, I think it's great to hear that people are keen and wanting to get vaccinated. That's what we want to hear, so that's brilliant. So the vaccinations are being done in a priority order, which has been determined nationally, and this has been determined by the Joint Committee on Vaccinations and Immunisations. They've put patients or people into priority groups, and we're starting with the 80 and overs, and with care home residents and with care staff. They're the top priority group. The logistics of getting the immunisation out to care homes, that's just ongoing at the moment, but these are the groups that are thought to be most at risk, known to be most at risk, so it's important that we start with those. And then we'll be working down the list. Basically, it works down through age groups, it works down through people with other conditions that make them vulnerable. So for example, the people who were shielding, the extremely clinically vulnerable, they will be high on the list as well, whatever their age. And as more vaccine becomes available, it will be rolled out to the different groups. So at the moment, it's, you know, the vaccine isn't coming in huge numbers, so we're starting at the very top of the list and then working down. But in time, everybody will get their vaccination in that priority order. So, you know, we're asking people to be patient. We do understand that, you know, this is available now and people want to get it, which is great. But, you know, it's as the vaccine becomes available, then we can roll it out to all the different groups. With regards to the hospital staff, that's not an area that I'm really sort of able to comment on. I don't have any sort of knowledge or input of that, about that particularly, other than that healthcare staff, frontline healthcare staff are, you know, the top of the priority list, and, you know, and as and when the vaccine becomes available in the sufficient quantities, it will be rolled out. But I can't give any sort of advice on timings or anything like that at the moment.
Well, just throw that last bit over to Sharon, please, Sharon.
My understanding is the same as Gill's, that, you know, there are all of the logistical issues that we've already talked about in terms of getting the vaccine to where it's needed. So obviously York Hospital, both sites, the York site and the Scarborough site, will be on that list for the vaccine to become available. But I must confess I haven't seen a definite date for that as yet.
Right, thank you very much. Sharon, we've now got a question about what happens at Christmas. And I know, because I've been watching it today, that things have changed. So people are saying, are there conflicting rules about Christmas? Can we form a Christmas bubble? And what's sensible? Can we go out for Christmas lunch?
So the rules around, or the guidance really around Christmas hasn't changed. and we can put the link to that. Our comms team who are working behind the scenes will be able to put the link to the guidance on the Facebook page for anyone who's watching, and the link is on the council's website, the coronavirus pages. So the rules for England haven't changed. I understand that Scotland and Wales will be reviewing their guidance around this. But what has changed, I think, today is the general advice that the Prime Minister and Professor Whitty, the Chief Medical Officer, have given, in that the rules are there that allow 3 households to form in a Christmas bubble. The rules allow you to travel to meet up with family. But what we're encouraging people to do is to stop and think about whether they can do that safely. And that has to be an individual choice, because everybody's family circumstances are different. And obviously, if you have a frail or elderly, or perhaps a family member who is terminally ill, and you're concerned that this might be the last Christmas you spend with them, then obviously I can completely understand, and we can completely understand why you would want to meet up with them around Christmas. But it's about being able to do that safely. So if you are wanting to meet up with a vulnerable person over Christmas, it's good advice now to think about minimizing the number of contacts you have with other people, so that if you can self-isolate, then do that, or certainly minimize the contacts you have with other people, so that you're minimizing the risk of being exposed to infection before you meet up with your loved one. When you then do meet up, it's absolutely crucial that you continue to follow the public health guidance. So hands washing, absolutely key. Wearing a face covering is also key, and ensuring that there's good ventilation. So meeting in indoors, in a warm, centrally heated house, with people coming together, are the conditions in which the virus can really flourish. So opening the windows, even if you can't open the windows and leave them open all the time, if you can just open the windows and doors a couple of times through the day, just to get air flowing through, will also be really beneficial. For other people then, if you can avoid meeting up with people over Christmas, and perhaps plan a Zoom Christmas, then we're encouraging people to do that as well. Or meet up with perhaps one other household who is local, and to try and discourage people from traveling to far-flung parts of the country, and meeting with large groups of people together. And so the advice really is to just be very cautious, to be sensible, and to make sure that you follow all of those infection control guidance. In terms of whether you can meet in a pub, no, I'm afraid you can't. The rules around Christmas are that household bubbles can meet in a household, but you can't meet in an indoor area. You can meet outside, but you can't meet inside a pub or restaurant. So you can have your Christmas meal together at home, but you can't book a table in a restaurant to have your Christmas meal, for example. But again, I would encourage people to go onto the website and check those specific advice there. And If people aren't sure about what they can do for your individual circumstances, you can always contact the council's public health team for advice or to talk through your individual situation. And that is inquiries.publichealth@york.gov.uk. And there's a telephone number as well that our communications support team can put on Facebook there. So if you're worried, you're not quite sure what to do, then you can talk that over with one of the public health team that can help you work through how you would be able to meet together safely if that's what you feel you need to do.
Thank you very much, Sharon. Now, we had a very interesting pre-submitted question, which I'm going to split into two, because it's certainly a question that is, the first bit has come to my mind several times, and I'm going to get Owen and Gill to comment on the first bit, and then the second bit, Alyson, and then Sharon. So this is about what the questioner calls the ridiculous rules about pubs if having to serve a meal. And they are saying, does COVID really respect diners but attack drinkers? Owen, is there any scientific background or evidence for that you know of?
The reason for these rules is twofold. It's the same with the going to sporting events. It's actually about stopping the movement of people. It's not about the amount of time you spend in the pub. The other reason is that with people who sit and drink and eat, have a different behaviors. They don't move around as much. They don't circulate as much, hence transmitting. They tend to come, spend an hour and a half eating, have a few drinks, and then go home. So it's about preventing the spread of the transmission of the virus from person to person in an enclosed environment.
Gill, would you like to add something?
Yes, and I agree with Owen. I think it's about the social distancing, isn't it? So it would be unusual standing in a pub having a drink and everybody standing 2 meters apart. That's not really what you do in a pub when you go for a drink, is it? So I think the reasoning behind it is related to that. Whereas I suppose if you're going and eating, you're more likely to be sat at a table and sat across from somebody at a further distance. So yes, I would say it's probably, you know, all part of the basic public health messaging that we're trying to get across how important the social distancing is.
Thank you very much. Now, the second part of the question, Alyson, is a very interesting one. It says, what's the council, and I would include the voluntary organisations, doing to assist pubs and restaurants with the vast quantities of food, which the questioner says is just going to waste? Are there any mechanisms in place for this to be used for the needy or the homeless in the city? And I wondered if you wanted to talk a bit about the hubs.
There is lots of information available on the hubs on the City of York Council website, and I know certainly before we could plan to a certain extent, there was food was donated to that and to the food banks as well, and some organisation businesses already had relationships with existing charities. So before even COVID happened, some of them already had those existing relationships which we'll be able to build on before as well. And I think going forward, one of the issues has been that giving businesses time to plan. So knowing that they weren't going to be open allowed them to sort of let their stocks go down a little more naturally this time than that sudden, this is not going to happen and we need to be able to get rid of those. So yeah, information available on the website, but certainly there has always been good links between the businesses in York and the charities about being able to give food and produce that wasn't being used to them as well.
Lovely, that's very reassuring. Sharon, can you add something?
I would agree with Owen and Gill and those comments that have been made. I suppose the only point I would add is it's much easier for the businesses, you know, whether that's a pub or a restaurant, to be able to control that environment, to position tables and chairs so there is that social distancing, but also the cleaning routine. So pubs and restaurants have a very detailed cleaning regime that they go through. And also they need to record the details of who has entered their establishment for NHS track and trace purposes. So it's a much easier environment to manage in a COVID secure way if you have people largely seated. And as Owen has already said, if you've got somebody that is eating a main meal, then other than when they get up from the table to visit the toilets, for example, in which case they need to put a face covering on because they're going into a communal area, it's a much safer environment than in a normal pub environment where people are drinking and milling around, etc. So it is for infection control purposes that these rules have been brought in.
Good. So, Sharon, is it safe for us to go shopping?
Yes, it is safe for people to go shopping. Obviously, if you're in the clinically extremely vulnerable category, you may want to think about the time that you go shopping so that you're shopping at a quieter time where there's likely to be less crowding in shops, for example. But yes, provided again you wear face coverings, you're washing your hands or sanitizing your hands regularly, and as far as possible, you maintain social distancing. I accept that can be quite challenging if you're in a busy supermarket, for example, and somebody's queuing very closely behind you. But it is possible to very politely say to someone, you're making me uncomfortable, you're standing too close to me, can you please move a little further away? And again, shops, the vast majority of shops have put in quite a lot of measures to keep people safe. I would add, though, if I may, Carol, that if you're out and about and you're worried that shops or businesses or wherever you are aren't following the COVID secure guidelines, please contact us. We do have an environmental health team, trading standards team, public health team within the council. We will always act on any reports of shops or businesses that are flouting COVID rules. So do contact us. You can contact us anonymously if you want to, and we will be able to follow that up. So please don't be afraid of contacting us and raising your concerns if you've witnessed unsafe practice and you don't feel that you can raise it at that time with a particular shop, for example. Then please let us know and we can follow that up.
Thank you. A question now for Owen. Jane on Facebook has asked, once more people are vaccinated, how long do you estimate it will be before we can get back to normal?
Great question. It's a difficult one to answer, but this is the way I foresee it going. It's like when we watch the news every night and we see the R number go up, we see the number of positives per 100,000, we see the NHS admissions, we're seeing that going up. What we want to see with vaccination, and this is why it's so important we get a good coverage in the country, is once we start to see all of that drop down, like kind of we did in the summer, once that drops down, then we'll start to see the effect. I can't predict when exactly, but I do know we are over the worst.
That's lovely, thank you. And a question for Alyson.
Can I come in there,
do you want to come in? Yes, please do.
Carol?
Yeah.
I think perhaps Owen is being too optimistic. it is going to be some time before 70% of the population is going to be vaccinated, which is the level we really need for what we call herd immunity. And we discussed earlier the logistical issues around the vaccine being produced in large enough quantities to allow for 70% of the population to be vaccinated. And we know that it doesn't take much for this virus to get out of control. It can get out of control very, very quickly. So even though we have the vaccine on the horizon, realistically, we're talking of the summer at the earliest, or maybe potentially the autumn, before enough people are going to be vaccinated for life to get back to normal. It will get back to normal. We hope and pray that next Christmas will be normal and it won't be like this Christmas. But we can't let people relax thinking that the vaccine's on its way. You know, those public health measures still have to be followed, and the NHS is not out of the woods yet. We haven't seen the worst of the winter weather yet. We know people will be relaxing and getting together over Christmas, and we're then going into New Year. We're then into the height of the flu season and all of the other viruses that circulate every winter. So fabulous, we've got the vaccine, but realistically, people just need to prepare themselves for life not getting back to normal until I would suggest the summer at the earliest.
Okay, right, Alyson, advice for people that have to stay at home and self-isolate over Christmas. What advice will you give them?
I think making sure that you're trying to be in contact with as many people as you can over whatever method that suits you. I think one of the things that we've noticed, especially at the moment, obviously initially we saw rising levels of anxiety, but what we're seeing now are people struggling with the idea of things that are not going to be quite the same as they used to be, and that unknown. And as we all know, we start thinking about Christmas in this country in about July when things go in the shelf, and it's pushed and it's quite a big deal. And I think people are then starting to think, oh, this is going to be absolutely dreadful. And people have been talking about Christmas being cancelled. It hasn't been cancelled, but the focus needs to be on the bits that you can control about Christmas. And that would be the same for people who are at home as well, self-isolating. There will be lots of people who often spend Christmas on their own. And actually they can give quite good tips as well on saying, you know, this is how I deal with it. And of course, being on your own for everybody doesn't necessarily mean that they are lonely, but certainly being able to reach out, even if it's on the telephone, if they have social media, to be able to access various of the things that will happen on social media. Some of them are often national, so there's often hashtags about, you know, if you're on your own this Christmas, you can go on various Twitter feeds and be able to follow, and people will send messages to each other. So we have got other ways to communicate, and that is what our need is. That's what helps us feel better, to be able to share with other people. And I think also in that run up to Christmas as well, to actually say to somebody, actually, I'm going to be on my own, because sometimes people don't always know, and they think, well, you know what, I could do a Zoom call for that. So making sure that you know, but also talking about it, I think, and then you can rationalize sometimes that idea of this might only be for a day, or this might only be for 2 days. But certainly trying to have as many conversations with as people as you can. It just helps us feel better, even if we feel as though, well, there's nothing anybody can do to change this. Just having that conversation with someone tends to be able to lift people's spirits as well.
I think people need to know there are other people in the world, because sometimes it feels as if there isn't.
Absolutely.
Yeah. Right, Jill, I've got a wonderful question for you. Gillian has emailed her question. She's got a girl from Huddersfield that has lived with her family since September. She's studying at a local university, and she wants to return to see her family in Kirklees on the 23rd of December and return a week later. Gillian has told her she's travelling to a tier 3 area. She'll have to take a test before she can return to her family here in York, as her partner has a bad heart and I'm a carer in the community. how does she go about this, if you can follow all that one?
Right, okay. So she's been told she's got to take a test, has she? Or she's wondering whether she should take
The people
a test?
with whom she is staying,
Yeah.
one of whom has a bad heart and one of whom is a carer, have said to her that they'd like her to have a test before she comes back into their family, having been into Huddersfield, which is a tier 3 area, and she wants to know how that would happen.
Yeah. So at the moment, testing for people who don't have symptoms isn't generally available through the NHS. There are some particular areas where this is starting to be rolled out now. For people who are working, for example, in the COVID vaccination clinics, that may be a possibility to have a test if you don't have symptoms. But I'm not aware, Sharon might be able to help on this, I'm not aware of any testing that people can get if they don't have symptoms in this kind of situation. Some of the universities, I believe, are offering the testing before people come home. So it's possible that she may be able to access something through her university. But in that particular situation, without knowing a little bit more about who's advised that, I'm not sure from a GP perspective I would be able to signpost anywhere. But perhaps Sharon might have some more sort of public health advice on that.
Yeah, I'm assuming this is not based on clinical advice. It's what the family are wanting for their own peace of mind.
Yeah.
So some local authorities are now introducing asymptomatic testing or symptom-free testing using the new lateral flow rapid tests. So we're in the process of rolling that out in York. And it's entirely possible that the local authority that she's going to visit may have something similar in place as well. So what I would suggest is that she checks on the relevant local authority website to where she's going to see whether they are offering asymptomatic testing. If they are, then she would be able to book, or if they do a drop-in with no appointment, she would be able to drop into that facility or book an appointment and have a rapid test done before she came home. Provided that was negative, obviously, she would be able to travel. If it was positive, she would have to stay where she is and have a follow-up PCR test, so booking a test through the NHS test and trace. And if that was positive, then she would have to stay where she is for 10 days before she would be able to travel home. The alternative would be, if she's coming back to York, is that she books a test as soon as she gets back to York, or before she travels home. If she knows the day she's going to be travelling home, she can go onto the York Council's website and she can book a lateral flow test either for the day that she comes home, so that she can confirm that she's negative. So she's got either of those options that she can explore.
I'll just check with Owen. As far as I know, both universities have been doing some asymptomatic testing, haven't they?
Correct. It's been optional asymptomatic testing in both universities in York.
Okay, right, that's good. Right, the $64,000 question comes to Sharon. Kaylee on Facebook says, do we know what tier York is likely to be in? And everybody can comment on that if they want.
It's an excellent question, and it's one that is kind of, hovering in all of our minds, isn't it? So we haven't had an official announcement yet as to which tier York is in, but I'm expecting us to be in tier 2. And that's really because even though our case numbers are down, which we talked about earlier, and our positivity rate is down, so the proportion of tests that are being done that are coming back positive is low as well, those are not the only criteria that the government takes into account when looking at tiers. They look at what's happening with the NHS. They look at how busy primary care is, how busy the hospital is. They also take into account some of the things we were discussing earlier, that, you know, if York were to go into tier 1 and everywhere else is in tier 3, as we talked about earlier, that might encourage more people to travel into York. So they take all of those things into account. And when you look at that whole scenario, I don't believe that York is ready to go into tier 1. And I may be wrong, and I'll have to admit I'm wrong if the announcement is we go into tier 1 tomorrow, but I think we will stay in tier 2. What will be interesting, and I think North Yorkshire will stay in tier 2 as well. What will be interesting is what happens to the rest of Yorkshire, who are in tier 3 at the moment, and whether they will stay in tier 3 or whether they'll come down into tier 2. I suspect that they will probably stay in tier 3, and so we'll see no change of tiers heading into Christmas, is my best guess. The government will be reviewing the tiers again on the 30th of December.
Yeah.
So we'll wait to see what happens then.
I'm going to pop in what I think will be the last question, which is for Alyson. It's a very heartfelt question that has come in. May on Facebook says, what long-term effects are we expecting to see on the mental health of the community? The summer, she says, was warm and sunny, so arguably easier to deal with. But now it's dark and cold, it's harder to cope.
Yeah, I think the long-term effects are we're going to see more people struggling with their mental ill health. I think that's already started to show through the research that we've been done, and there are some groups that will be disproportionately and already being disproportionately impacted both by COVID and by their mental health. So groups who are of people who are living in poverty, those in Black and Asian and other minority ethnic communities. We certainly started to see COVID having an impact, and mental health, which was already an issue in some of those communities, becoming worse. I guess in some ways what the questions you probably want answering is, what is it that we're all going to do about it? And it does feel as though there's been quite a lot of emergency measures put in, not just by funders like local authorities and health, but also from places like grant funders that the voluntary sector often get quite a lot of their money from as well. And actually in York, we have had some really, really exceptional support from local businesses who have quite honestly donated in terms of money for us to be able to support our services as well. It's been really noticeable in York as that. I think going forward, what we hope to see our grant funders starting to look at that longer term impact and to make sure that support is starting to be tailored particularly at those groups that we're seeing. Interestingly, one of the other groups is young women. That's coming out as quite noticeable, really high levels of anxiety coming through from young women as well. So hopefully going forward, we will be able to mobilise to be able to offer quicker support into early intervention services and low level, so that people who are suffering with really severe mental ill health are able to access those higher tier services. So yeah, I do feel at the moment it feels as though there are some positive signs around what we might be able to do go forward, but we are expecting to see quite a significant impact on people's mental health over the next probably 6 months to 2 to 3 years.
Gill, can I ask you to make a short comment, because I'm sure you must have encountered this in the surgery?
Yes, and I think, like Alyson says, you know, people are feeling more anxious, they are feeling more stressed, and it's affected some groups to a greater extent. I mean, we certainly would encourage everybody to come forward that is feeling any sort of mental health effects as a result of COVID or as a result of anything else. Please do remember, we are all here. Contact the services, contact the GP service. We're here to talk. We don't want anybody to feel that they're on their own and suffering. So it's really important to get in touch. You know, all the services are open. I think, as you say, with it in the dark, perhaps that's the time of year when people tend to feel more depressed anyway, when it's dark and cold, and at the best of years, you can't get out so much. So it's all been compounded by the COVID. So my key message would be to don't suffer at home and not contact. You know, get in touch. We have all our normal services open. There's also the NHS Volunteers Service, which we've had fantastic numbers of people come forward and volunteer, and they can provide things like weekly check-in calls with people who are perhaps lonely and isolated and living on their own. We have social prescribers who are community sort of link workers in the practice. They can put people in touch with charities and other services that can help support them. So please, if you're feeling down or anxious and you're isolated, please do get in touch with services and we can help.
Thank you. I think we've run out of time, although we did have a question about false negatives. But I think that we haven't really got time to go into it at the moment. So I can only say what a lot of people have been saying, which if you have further questions, let us know and we'll try and get an answer to you. If you are concerned about something, ring us up, 551 550 at the council and the other helplines that have been mentioned, but don't suffer in silence and don't leave questions unanswered that you really want to know the answers to. So with an eye on the time, I'm going to start drawing this evening's session to a close. And I really would like to thank everybody who's asked a question today. We've covered a lot of topics. It's incredibly important to us to hear your views and keep an eye out for future Facebook Live QAs on other important subjects over the coming weeks that you may like to send further questions into. I'm very grateful to Owen and to Alyson and to Gill and to Sharon for giving their time and their insights. They've all given us different aspects of the same problem, and it's been very helpful to hear them. Before we go, just to flag, if you have any views and comments on the issues we've discussed, share your views as part of our big conversation. And you can see details of that on the council website, as this helps to develop the council's approach to some of the big challenges we're facing at the moment. Leave comments and questions in the comment box and a member of our communications team will respond. So the last thing to say is thank you for joining us tonight and have the very best Christmas that you can. Thank you.